Novel coronavirus yang seolah-olah masih tiada vaksin.
Elakkan pergi ke epicenter
Kalau boleh lah.
Kes-kes ni dapat dikesan dan dikuarantin di hospital ataupun di rumah.
Terdapat 86 rakyat Malaysia di Wuhan.
Sosioekonomi Bumiputera ini tidak boleh dipisahkan, tidak boleh dikurangkan ataupun ditinggalkan.
Pasal apa syarikat tu rugi?
Kira sukses.
Success is not necessary pada saya lah. Kalau kita nak menolong sesuatu.
Novel coronavirus yang seolah-olah masih tiada vaksin.
Elakkan pergi ke epicenter
Kalau boleh lah.
Kes-kes ni dapat dikesan dan dikuarantin di hospital ataupun di rumah.
Terdapat 86 rakyat Malaysia di
basically, I think you want to do all those who show symptoms of respiratory infection. Yeah, those who show evidence of ILI, influenza-like illnesses. Those who show evidence of SARI, severe acute respiratory infection. I think these are high risk. They must be tested. Yeah, and then when you have plane loads of our children coming back from Iran, from London, from Italy, yeah, from China, you want to test all of them. We have seen children coming back positive. Yeah. So the other problem is this, Melissa. This is a very, very smart virus. They are actually infecting us whilst we are asymptomatic. Yeah? So, which means that the incubation period is anything between 2 to 14 days. Most of them show symptoms at around 7 days. But in the first 2 or 4 days, they may not show any symptoms. They do not show any signs of COVID disease. And they can be very infectious.
Dr. Musa, talk to us about capacity. Does our health system have the capacity to do the kinds of testing at the levels that you are, the intensity that you are advising today?
Capacity is a measure of preparedness. When it hit us on the 31st of December, how prepared were we? Did we forecast how bad it was going to be? So I think that was there was a lag there. Yeah.
Okay.
And I'm sure that funding was a major problem. But whatever it is, I think they're on the right track. We need to do this fast. We need to understand exactly what is the burden of the disease. Yeah. Okay. And we've got tests available since very early in February. Yeah. In fact, the Chinese told the WHO and they told their colleagues in Australia the genome, and they were able to make available the test in early January. Yeah. So.
Okay, so can I come back to the funding, Dr. Musa, about that? I mean, the cost of testing is an issue as well. Testing costs about 450 to about 1,000 ringgit. Now, you tweeted yesterday that you said the cost price for testing is between 150 to 200. Can you explain the differential between the prices?
Well, it's Sharaad. The cost price is about 80 ringgit. You throw in the call hours, you throw in the PPEs, you throw in the other paraphernalia, probably works out to anything between 100 and 150 ringgit. Yeah? But some of the hospitals are charging anything between 500 to 1,000 ringgit. To me, this is obscene profiteering, and this is where government needs to step in. And I think there was failure in the government to make sure that the test is made affordable, right? I think it's high time, just like not just for testing, but also for our PPEs, for our masks, that the government steps in and makes sure that there is a limit as to what the price should be. And I think you have to make it affordable that more people can come forward for the test.
Explain to us, Dr. Musa, the reasons for early testing, or as much testing as possible. Is it about early intervention, especially in the face of what seems to be no cure for the disease? Why is early detection important?
Hang on, Sharaad. When you test, you identify your positives. So what follows next is contact tracing. So every person that was in contact with that guy needs to be traced, and that guy and all of the contacts needs to be isolated. So testing goes in tandem with contact tracing, i.e. tracking goes in tandem with quarantine. And of course, the next step is social distancing. So it is this quarter of interventions that will ensure that we flatten the COVID epidemic curve.
Okay.
Yeah.
Well, you talked, Dr. Musa, a little bit about how, the testing, everybody needs to be tested, right? But the Health Ministry today said that there is no need for the public to use any kind of rapid test kit. Can you help explain why this rapid test kit is not recommended for COVID-19 testing?
Let me just very quickly explain the evolution of the introduction of the virus into our blood. Initially, we have the RNA COVID as SARS-CoV-2, yeah? It goes into the bloodstream. The viremia, that's the RNA. And then, by around 2 to 4 days, it develops the fever, the cough. That's when the antigen appears. Yeah? And then, towards the end, 10 to 14 days, the antibody appears. So the best test to get it early within the first 2 to 4 days is the PCR, the reverse transcriptase or real-time polymerase chain reaction. This is a wonderful test. The guy who invented it won a Nobel Prize. Basically, with tiny amounts of RNA, it is able to amplify it and then detect the 3 gene loci, right? So that will tell you an early diagnosis. Whilst this rapid test is based on the antibody. And as I mentioned it to you just now, the antibody only appears towards the convalescent stage, right? Whilst we hope another test that may come to the market is based on the antigen. When the patient becomes symptomatic around 2 to 4 days, the antigen appears in the bloodstream, and you detect it with a rapid test, which can be done within 45 minutes. But we've yet to see a kit in the market.
Well, thank you so much for joining us this evening and sharing those insights with us, Dr. Musa. We're going to take a quick break and we'll be back with more on Consider This. Stay tuned.
Kami bawakan berita, isu semasa dan kisah dari bumi kenyalang.
Pencapaian anak Sarawak di peringkat nasional dan antarabangsa.
Laporan politik dan juga ekonomi.
Berita sukan dan hiburan.
Terus bergulai medak AWANI Sarawak, Ninteng Ari 501 Astro AWANI.
Kami bawakan berita, isu semasa dan kisah dari bumi kenyalang.
Pencapaian anak Sarawak di peringkat nasional dan antarabangsa.
Laporan politik dan juga ekonomi.
Berita sukan dan hiburan.
Terus bergulai medak AWANI Sarawak, Ninteng Ari 501 Astro AWANI.
Kami bawakan berita, isu semasa dan kisah dari bumi kenyalang.
Pencapaian anak Sarawak di peringkat nasional dan antarabangsa.
Laporan politik dan juga ekonomi.
Berita sukan dan hiburan.
Terus bergulai medak AWANI Sarawak, Ninteng Ari 501 Astro AWANI.
Kami bawakan berita, isu semasa dan kisah dari bumi kenyalang.
Pencapaian anak Sarawak di peringkat nasional dan antarabangsa.
Laporan politik dan juga ekonomi.
Thank you for staying with us on Consider This. Melisa and Sharaad here with you this evening. Let's now turn our attention up north, where Thailand's Prime Minister Prayut Chan-o-cha has announced that the country will go into emergency mode for 1 month starting Thursday, March the 26th. Now, Thai citizens have been told to stay put and not return to the provinces. Yesterday, the Thai government closed 9 border checkpoints to Malaysia until further notice. Designated trade routes, however, remained open but tightly controlled. Joining us on the line to discuss this further is Datuk Joji Samuel, Malaysian ambassador to Thailand. Thank you so much for joining us. Now, how exactly will the newly announced emergency measures impact Malaysians currently in Thailand?
Hi, Melisa. Good evening, Sharaad. Thank you for inviting me to give some views on what is happening here. With regard to the declaration by the Thai government, Thai Prime Minister today, he has declared a nationwide state of emergency in a step-up effort to stem the spread of COVID-19. So far, it has affected 827 people, and we have 4 deaths so far in Thailand. Now, it will definitely, few days ago, what Prime Minister Prayut Chan-o-cha has done is that he came out with they call it a soft lockdown, which well, people can move around, can go to their offices to work, but limited. They can't go to the, as usual, some of the entertainment centers, the boxing, stadiums have been closed. So they are limited to going only to buy food at the supermarket, at the restaurants and takeaways. But with this emergency decree,
Dr. Joji, could I just ask you, how will this impact Malaysians? I mean, how many Malaysians actually live and work in Thailand who are going to be impacted by this?
Okay, we have currently about 1,200 Malaysians registered with embassies. Well, the Malaysians so far, I mean, they are impacted in terms of, most of them, they are doing business here. They are working with the private sector. And those who have their own business, certainly they have to close their factory. It would involve in terms of the operations of their factories, their companies that they run here. One of them runs a tourist agency, tour agency here. So definitely that has impacted a lot in terms of number of tourists coming in into Malaysia, into Thailand.
So I'm sorry to interrupt you, but I want to come back to, we mentioned a bit earlier that the government has closed 9 border checkpoints, but the designated trade routes have remained open. Now, I'm just thinking about the Malaysia-Thailand border and how porous that is. Is that a source of concern at the moment?
Definitely. I mean, if you look at our border, it is about 668 kilometers. That's the land border between Malaysia and Thailand. And we have, as you mentioned, we have 9 border checkpoints, which currently now has been closed to movement of people. But they have managed to. What we have done is that between the both countries, few days ago, my foreign minister, Datuk Sri Hishamuddin Hussein, had a telephone conversation with his counterpart here, Thai foreign minister. And one of the issues they discussed is that on how both Malaysia and Thailand could handle this COVID-19 issue, both bilaterally as well as within ASEAN. And what they have agreed is that we have the border checkpoints remain open, and definitely we have to step up the border checkpoints, border control and monitoring. We have currently existing mechanisms under the Regional Border Committee and the General border committee between both countries to control and monitor the borders.
I see.
So we have managed so far, been successfully managing that, and we are trying to avoid any exploitation of our common borders by undesired elements.
All right. Thank you so much for joining us this evening, Dato' Joji. I appreciate your time. That's all the time we have for this episode of Consider This. I'm Melisa Idris. With me, Sharaad Kuttan, signing off for the evening. Stay home and stay safe, everyone. Thank you for watching and good night.